Parents will know when their baby is ready to move on to solid food when they have reached the age of 6 months. We want them to be sitting unsupported with good head control and able to reach and grab objects accurately. Parents should start moving their babies onto solid food very slowly. Babies should be offered savoury foods to start with, such as soft cooked vegetables. Take everything at the baby's pace, and it should be very much baby-led. Parents should start giving their babies food sitting in a high chair. They should continue to give milk as normal, so a breastfeeding mum should continue to give breastfeeds. Formula feeding babies should continue to have the same amount of formula milk. Parents, when they start moving their babies onto solid food, should be offering a variety which helps their baby get used to the textures, tastes and smells of different food, making them less likely to develop sensory feeding difficulties later on. Mealtimes are about sitting as a family and enjoying the social experience. Ideally, this should be sat round a table with your baby securely fastened into a high chair, but if this isn't possible, then as long as your baby can sit comfortably and safely on the floor, this is fine. Never leave your baby unattended. Gagging is a normal reflex in babies. It helps prevent choking, and it's a normal response to new tastes, temperatures and textures.
Never force feed your baby. Some babies take a while to get used to new foods. You want to encourage a positive environment so that they can enjoy food. If your baby does refuse to eat a particular food, remove it without comment and offer it again another time. You may need to offer your baby food 15 to 20 times before they start to eat and enjoy it. Allowing your baby to get messy is an important part of their development and helps them to learn about food. To achieve a healthy, balanced diet, you need to include food from each of the following 4 food groups. So first would be fruit and vegetables. Second, bread, potato, pasta, rice, breakfast cereals and other starchy foods. Third would be your meat, fish, eggs, beans, lentils and other non-dairy protein sources. And fourth would be your dairy. So for babies and children, we're really talking about milk, yoghurt and fromage frais. As part of this, it's important to give your children full-fat dairy foods, butter, margarine, oils, so they get the extra fat and vitamins that they need to grow and stay healthy.
Parents, when they start moving their babies onto solid food, should be offering a variety of foods, but they need to be mindful of processed foods, foods that are high in sugar and salt content. The idea is that babies should be enjoying meal times with parents, so whatever the parent's having, they can offer their baby those foods. There are certain foods that we do recommend babies avoid. These are whole nuts to avoid the risk of choking, and runny eggs unless they are stamped with the Red Lion stamp. Honey needs to be avoided until 1 year. Avoid tea and coffee as they contain tannins which prevent the absorption of iron. Milk and water are the best drinks to offer your baby. Parents should avoid processed foods and foods that are high in sugar and salt, and they should avoid adding any sugar and salt to the foods that they offer their baby.
If you have any concerns regarding your baby's oral intake, please speak to your health visitor or GP. Potential allergenic foods include cow's milk, eggs, nuts, peanut products, seeds, wheat, gluten, fish and shellfish. Do not give these foods till your baby is at least 6 months old, and only give them in very small amounts and one at a time, so you can watch out for any allergic reactions. If you are worried your child has a food allergy, these are the things to look out for. Breathing difficulties, runny nose, stomach upset, skin reaction, so blotty, raised red rashes, itchy patches and swelling around the mouth, or sore red and itchy eyes.
If your child shows any of these symptoms in association with food, talk to your GP for advice or call NHS 111 for non-urgent medical inquiries. If you think your baby is suffering a severe allergic reaction, always call 999 and ask for a paramedic.
The Department of Health recommends that all children from 6 months to 5 years have a supplement that contains vitamins A, C and D. Babies from birth to 1 year who are breastfed should be given a supplement containing 8.5 to 10 micrograms of vitamin D daily. Babies who receive more than 500 ml of infant formula, which is about a pint per day, do not require vitamin supplementation as the infant formula is fortified already with these nutrients. Women who are breastfeeding their children should consider taking a vitamin D supplement of 10 micrograms a day. So for more information, go to the following sites: Start for Life, NHS Choices, Healthy Start, Bliss, and then there's the British Dietetic Association.